Emend Healthcare's ultimate goal is clear: building the skills clients need to leave our facility and thrive in an independent living environment. In a caregiving setting, the natural instinct is to be as helpful as possible. But when it comes to medication management, taking over and doing things for the client creates serious safety risks. Every Emend staff member must memorize a strict legal boundary called the bright line. It separates self-administration from administration. You operate strictly on the self-administration side. You can hand the client the container, but they must identify, decide, and physically take the medication. Selecting, preparing, or dispensing the dose yourself is a licensing violation and potentially a criminal act. It removes the client's legal agency and compromises their physical safety. To stay safely within your scope of practice, the law outlines exactly 6 permissible actions you can take. You may remind the client, retrieve and hand them the container, open child-proof caps if they are physically unable, read the label for them, verify the medication matches the orders, and observe and document the dose. Imagine a client is having trouble swallowing a large tablet. A well-meaning staff member might think the logical solution is to crush the pill and mix it into a cup of applesauce. Doing so crosses the line into medical administration. Crushing, splitting, dissolving, or mixing medications alters their chemical delivery mechanism, which can be dangerous for extended-release formulas. The correct response is to stop, leave the medication exactly as it is, and contact the prescriber to request an alternative, like a liquid or a chewable tablet. Deferring to the prescriber for an alternative form keeps you strictly within your legal scope of practice while protecting the client from an adverse clinical reaction. As needed, or PRN medications, introduce a different type of risk. Unlike scheduled daily pills, PRNs require a clinical decision about when the medication is actually necessary. On an evening shift, a staff member notices a client pacing and looking anxious. The staff member decides the client is stressed, fetches a PRN anxiety pill, and hands it directly to them. That single interaction breaks 2 major rules. First, the staff member made the clinical decision of need. Second, they placed a loose pill in the client's hand instead of giving them the pharmacy container. Before any staff member can assist with a PRN, there must be a written statement from a physician on file, explicitly authorizing the client to determine their own need for that specific medication. The correct approach is to gently suggest the client consider their PRN options. You then verify the physician's note is on file, retrieve the labeled container, and hand it over so the client can make their own decision. Requiring the client to make the final PRN decision, supported by their physician's authorization, transforms a simple pill pass into a moment of self-management, a skill they must master before moving to less supported living. Physical security of the medication cabinet is just as highly regulated. An unlocked desk drawer where multiple clients' medications are mixed together is a massive liability. Centrally stored medications must be locked or double-locked for controlled substances, separated strictly by individual client and kept exclusively in their original pharmacy containers. When a client refuses to take their morning dose out of that secure cabinet, a frustrated staff member might feel tempted to coerce them or even hide the medication in their food. Clients have a legal right to refuse a medication. Your job is to respect that refusal, gently explain why the medication was prescribed, document their decision on the medication record, and notify the prescriber. Rigid storage security and respect for a client's right to refuse medication work together to keep the facility compliant while upholding the legal protections every client is entitled to. These interactions form the 4 pillars of medication competency at Emend: assist, never administer, never alter a medication's physical form, never decide a PRN need, and maintain strict, secure storage. Consistently following these protocols feeds directly into the client's individual medication management plan. The goal is for a client to progress from heavy staff support to a state where they can name every pill they take, articulate its purpose, and manage their own daily schedule with minimal supervision. Every time you hand over a labeled container rather than a loose pill, or ask a client to decide on their own PRN, you are deliberately preparing them for life outside the facility. Maintaining the bright line between assisting and administering ensures immediate safety today, while actively building the independence our clients need for tomorrow.